Good morning. We're joined by the ladies of IACC. Can you talk about a little bit about IACC?
Halo, selamat pagi. Good morning. The ELCC, or Indonesian American Chambers of Commerce, basically has the motto that we always try to consistently doing. The most important is reconnecting people, and we also link businesses. So based on that, our three mission is one, we help the Indonesian diaspora who would like to expand their businesses here in the United States. That's the most important thing. The second one, we help Indonesian people that would like to enter the American market, and the last one is we also help American company that would like to enter the Indonesian market. And today, especially today, we celebrate the Kartini Gala. It's not just the celebration of her birthday, but it also has the seminar on women empowerment.
Kartini is recognized as a major figure in the history of the advancements of women and a tireless advocate of women's education and emancipation. 1964, Kartini was elevated as the national hero by the first president of Indonesia, Soekarno. Those entire month of April has been dedicated to commemorate Ibu Kartini. She also frequently appears at the international events as speaker and moderator. Okay, when we invited Dr. Patuwo and Dr. Zhang, what we actually hoping from these discussions that from their experience as really accomplished females, we would like them to share, just to share how, or I guess as a female, we all know that it's really a huge hurdle and challenging to come to this point. So with Dr. Patuwo, I would like to do this almost like informational sessions. So, and I would like everyone to participate if you have questions to them. So please do so. And the first question that I would like to ask Dr. Patuwo, as the first generation from Indonesian family who's born and raised in the US, how do you perceive yourself and compete with others? So if you can share a little bit.
First of all, thank you so much for having me. I feel very honored to be here, and I'm so happy to even know that a group like this exists. And as a first generation Indonesian American, to be honest, growing up in Houston, as diverse as it is, it was actually quite tough because we didn't really know that many Indonesians. I was usually the only Indonesian in my class, in my school. And so growing up, it was difficult to find my identity. I remember growing up, we did a lot of school projects. Like we picked the country or picked something. I would always talk about Indonesia because no one really knew where it is in the globe, and no one had heard of it. And a lot of kids growing up really didn't know even how to spell it. So we did so many projects about Indonesia to teach our friends, our teachers about the culture. But myself, I didn't really understand it. And actually my family's Chinese Indonesian, which I later found out was a subculture of Indonesia, and it was really hard. I felt like I didn't really quite belong to the US, I wasn't really Chinese, and I wasn't really Indonesian. So to be perfectly honest, it was a struggle. There weren't that many role models. The one thing that did help was, this is a long time ago, I'm not as young as I look, but back then in Houston, there were not as many Indonesian people. So my parents joined an Indonesian church, and those were the only people I knew. There were maybe like 10 kids, and that was it. Those are the only Indonesians I knew here growing up. They're all still here, but now we see the community growing a lot, and we see Indonesian people more and more. And I think that's going to really help in terms of, being good role models for the next generation. And I think the more we bond together, then the more we can teach our community about our culture.
you, Dr. Patuwo. So the other thing that we would like you to share with us, while you perceiving your degree and now that you have the practice, what is the most challenging that you ever encounter and how you actually overcome that challenge?
That's a great question. It's been a long journey and it's been a lot of education. I think that everything, the education part it was hard, but it was doable. There was an easy map to follow, especially to be a doctor. You know, you have to go to a good high school, you have to go to a good college, medical school, training, so everything is mapped out. But after you finish training, then there is no guide. You can do so many things. You can work in the hospital, you can build your own practice, you can stay at a medical school and be a professor. So at that point, for the first time in my life, I did not have an answer. And to me, that was the hardest part. I decided to take a leap of faith and join a small practice here in Sugar Land. Never having been in a practice, never had a business on my own, never had staff or employees, and that was tough. And just figuring out, and it wasn't the medicine. The medicine I was trained to do, taking care of the patients became the easy part. The hard part was really figuring out life and figuring out the business part. And to be honest, the biggest challenge right now is being a mom or a working mom, and there is no book or guide for that. So that has been absolutely the hardest thing I've ever had to do, is being a mom and managing that.
Just out of curiosity, how many children do you have, Dr. Patuwo?
I have one. I have a daughter. She is 16 months.
Thank you. And as physicians who specialize in women's health, would you offer suggestions to all of the ladies here how to maintain the health? You know, as a whole, when we talk about the health, it's not just a particular body, but also the mind. So just give a very quick summarize if you can offer some kind of suggestions to them.
I think that's a great question. I look around the room and everyone looks gorgeous today, and everyone looks really good. And I think that speaks volumes in terms of our Indonesian background and genetics. I think that we are very blessed in that way. But of course, maintenance is equally important. So I take care of patients starting as early as age maybe 14, 15, all the way to the 80s. And I think that the most important thing starts in childhood. So exercise and diet is important from the very beginning, from the family. So, you know, a diet high in protein and vegetables is much better than a diet high in sweets and carbohydrates. And actually, the Asian diet and the Indonesian diet was good at that. And it's hard here in America because everything is processed or even ultra processed. And we think that's what's behind all of the chronic conditions like high blood pressure, obesity, diabetes, heart disease. And so we're blessed with already good basics in terms of diet and exercise. Our job now is to pass it on to that second generation, despite how busy our schedules are and how convenient the processed food is. So I think it all starts with diet and exercise. Now, in terms of women in general, we do recommend seeing a doctor just once a year, starting age 21. And that's to maintain, just to ask any questions and have a doctor there in case you need something. At age 40, we do recommend starting mammograms. Breast cancer is the third leading cause of cancer death here in America for women. It affects 1 in 8. So at the tables, I see there's about 8 people. So in a lifetime, one statistically would suffer from breast cancer. So we do recommend mammograms every year. And then starting age 65 or menopause, we do recommend bone densities. As Asian women, we are at higher risk for osteoporosis or bone disease, and it's important to treat that before something happens. But again, the biggest thing is really diet and really just maintenance of our bodies and keeping on top of that.
Okay, This probably this is the last question. Dr. Patuwo, would you just explain your practice, what location, what it is, and that what age that you care for the woman.
So I am located here in Sugar Land, and on the corner of 59 and 99, and we're part of Memorial Hermann. We're part of the Memorial Hermann Sugar Land Hospital Complex in Medical Plaza 2. I practice along with 2 other physicians, so it's just 3 of us. It's a small boutique practice. We do handle all OB-GYN. So the OB part is the pregnancy, so as soon as you're pregnant, all the way to delivery. So I do vaginal and C-sections. And then the GYN part is really comprehensive care for the whole woman. So we do everything from well women's to problem visits. And again, it does start, we usually encourage bringing younger women, usually around 17, 18, but as early as 14 and 15, if they're having problems to establish that care, that's usually when the pediatrician releases them, all the way into the 80s. So we're able to establish a good relationship with patients. Usually I see patients at least once a year, so I really do get to know my patients, and especially in pregnancy, I get to see them a whole lot, and that's the best part of the practice. In addition to that, our practice does have a med spa, and this is something we launched about 2 years ago, and this kind of talks about, it kind of references what we had talked about in terms of how beauty is just as important as brains, and we know that as women, it's an important part of feeling good and having a positive outlook on life. And so our med spa is full service. It includes facials, Botox, Dysport fillers, and we do have a medical esthetician on site at all times. So yeah, we're here to serve the women of Sugar Land. They're mainly from Sugar Land, but people come from all over Houston. And I'm more than happy to serve as a resource, especially for Indonesian women. I do speak Indonesian. I understand more, but I know that when people come, they may not feel as comfortable with especially doctors and healthcare professionals. So I'm a resource to anyone, and I'm more than happy to answer questions.
Thank you, Dr. Patuwo. So now we know that we do have the physicians, especially for specialty in the women's health, which is the Indonesian. So if you ladies looking for the OBGYN, you can contact Dr. Patuwo. Okay, now let's open up the Q&A. So I'd like to start from the corner to ask the question to Dr. Patuwo.
Hi, my name is Remy. I want to ask some question in here. Sometimes we see articles or TV segments about vaccination for young kids, for cervical cancer or something like that. But the thing is, in our community, it wasn't stressed out. So I would, because for sure, I am a mom of a teenager. I would like to know what vaccination for safety that I need my daughter to get.
The HPV, that
HPV vacation. Yeah. Vaccination. Yeah. Yeah, every time I ask, the thing about our culture, that's not like an open public thing. It's something that they don't actually tell us. So yes, could you explain, because I think it's very important for people who ask.
Yeah, that is an excellent question. And the reason that's an excellent question is actually cervical cancer is the leading cancer death in women in the world. Not in the US, but in the world. And the reason for that is around the world, they don't have as many screening opportunities. Here in the US, we do stress pap smears, and they're usually covered by insurance, and we start at really young at age 21. Cervical cancer affects younger women, so late 20s, early 30s, compared to the other cancers. Now we have a vaccine, and the reason for that is HPV, or human papillomavirus, we think accounts for more than 90% of cervical cancer. We did not know this even 10 years ago, that a virus was causing cancer. Now that we have identified that, we we can now vaccinate against the most common types of HPV. Not all of them, but most of them. The vaccine actually starts from age 9 until 26, and then October of 2018, they approved it until age 45. So a lot of women in this room that didn't qualify before now qualify. So 9 to 45, and that's boys and girls. The point is to vaccinate before you get exposed to the virus. And so we know that males can carry the vaccine, and for them it can cause other cancers. So we absolutely push for vaccinating the children as early as possible. And even if it's too late for some of us in the room, it is important to tell the younger generations to get vaccinated. A lot of people are against the HPV vaccine. It is quite expensive. It requires 3 vaccines. So you get it, 2 months later, another one, 4 months later, another one. And the biggest thing is they're worried that if the kids get vaccinated, then they feel like they can have intercourse and relationships, and it's not true. I mean, this vaccine is really to prevent cancer, not to prevent everything else. It doesn't prevent against pregnancy or against diseases, or sexually transmitted diseases. It is only for preventing cervical cancer. As of right now, we do not know any downside, a proven downside to getting the vaccine. And again, this is for boys and girls.
Okay, any questions from the audience? Okay, there's another one.
Okay, I have a question about copper IUDs and hormonal IUDs, and really what the main difference is and which one you recommend. For copper IUDs is better since you've already given birth.
So yeah, that's a great question. So IUD, for those that don't know, is called an intrauterine device. Around the world, it is one of the oldest forms of birth control. And it does more than birth control, though. It can reduce periods, and we use it for lots of things. But it is a device about this big. It is made out of plastic, and one of them is made out of copper. And it sits inside the uterus. Our uterus is our womb. And what it does is it sits there, and it's good for depending on the year. So there's 2 differences. There's one that has hormones and one that does not. The one that has hormones is good for up to 5 years, and the one without hormones is good for up to 10 years. The 5-year hormone one, although there are hormones, there can be side effects. So some people do complain of weight gain, mood changes, but most people like it. I'd say about 90% of my patients have no side effects at all. The hormone one is really good at reducing periods. So 2/3 of women on the hormone one do not have periods at all, and for a healthy reason. Okay? The 10-year one is made out of copper. It has no hormones at all whatsoever. So no hormones means no side effects. However, that being said, it's not going to help with the periods. Okay? So it's not recommended for like a heavy bleeder.
Okay, any more questions? Okay. Okay, these questions will be the last question to Dr. Patuwo because we need to move on to the next speaker.
I'm sorry, I forgot your name. My name is Titin.
Dr. Hilary Patuwo.
I have 2 questions. Since this is the last one, I have 2 questions. One question: when is for the teenagers to get checked up for pap smear? You know, because right now, especially in the state, some of the teenagers already doing something. You know what I mean? And the second one is I'm having a problem with body weight because this is what I thought. I'm taking a birth control for my period because I have a unbalanced period every 2 weeks. So the doctors gave me the pill, but since then my body weight is getting up and up and up. It never getting down. And this is too bad. We call it curcol. Ibu-ibu jangan julid. Tidak boleh julid di sini. So I thought, and the doctor told me like this. Well, let me see the document. You're the same body weight with the last time. So like, but that's what I thought is because of the pill. Is that true or not?
Yeah, I'll talk about that second question first. Weight gain not cause the weight gain by taking it every day, and the weight does plateau. Okay, so after the 10-15, even if you use the birth control pill for years, it's not like it keeps going up. Okay, the thing is, the reason it causes weight gain is because it increases appetite, especially at the beginning. I mean, there's definitely science behind it. So the key is picking the right pill. So there's about 100 different types of birth control pills, especially in the States. There's different brands, different doses, different colors. And so the key is picking the right pill that works for you, where you have all of the benefits, but none of the side effects. Okay? So that may not be a good pill for you. And the nice thing about pill is you can switch them every month until we find the right one for you. We don't always get it right the first time. So I think that taking a break off of the pill and maybe even switching the pill may be a good idea for you. In terms of the teenager real fast, pap smears start at age 21, but you bring a really good point. We know that, for example, HPV is transmitted sexually, and so we do recommend teenagers to come in as soon as they are sexually active, or even better, before they become active. So usually it's a good time for me to establish care in someone that they trust, someone that they can call. Maybe they're not as comfortable with their mom. And usually a teenager's first visit is about safe sex practices, birth control, kind of what they can do to take care of their body, especially as it's changing during those crucial years between age 13 and 21. Especially before college is the perfect time because they're going to go off and do their own thing in college. So usually the summer before college is the perfect time for me to meet them, and then they can always call us or even message us, even if they're in New York or California in college.
Thank you. Okay, well, thank you, Dr. Patuwo. Let's give a applause to Dr. Patuwo.